And the first one is birth control pills caused my infertility. So I was on birth control for 10 years. I came off to start my family, and I'm now unable to get pregnant. So it must have been the pill that did this to me. And so my answer generally to patients with that is that if you dig deep enough, the birth control pill usually in those scenarios was started for painful periods, irregular cycles. There was some underlying condition so that when you take the birth control pill away, the body reverts back to that baseline condition. So it's not the birth control pill that caused the infertility, is that there was an underlying issue that is now triggering or is now sort of responsible for the subfertility. And then the second myth that I think is worth discussing is that if you see a fertility specialist, that you are absolutely committed to IVF. Basically, if I'm going to go to this fertility clinic, that means I'm doing IVF. And I think that is a huge misconception. There is a reason that our fellowship is 3 years and that we do so much extra training beyond the general OBGYN. And I'm lucky to be friends with some fantastic general OBGYN. But when it comes to specific hormone reproductive disorders, there is nothing wrong with seeing a fertility specialist, having an evaluation, having testing, with or without the fertility treatment piece. And so the hope is that patients would seek out that care sooner. I can't tell you how many times there's patients who come after 2 years, 4 years. I think, some have even more. And it's because of this misconception that if they were going to see me, it was because they were automatically committed to IVF. So those are probably the two biggest myths that I debunk when I'm educating online.